Hi, I am Dr. Sampath Kumar MN, medical oncologist practicing at Bangalore, Magnum Oncocare. My experience in oncology is almost a decade. I have worked in various institutes in oncology. We all know incidence of cancer cases increasing globally as well as in India. According to the cancer statistics in India, almost 19 lakhs new cases are identifying. Out of that, mortality is 8 lakhs. It's really alarming. Okay, we all know the risk factors for the cancer apart from the tobacco, alcohol, food habits, and our day-to-day activities. Also, a contributing factor for our for the cancer incidence increasing day by day. We all know treatment. We include surgery, radiation, chemotherapy, target therapy, so on so forth. But more importantly, preventive oncology also should be included in our cancer care, because if you do preventive oncology better, we can prevent most of the devastating results in the cancer in early stages. If you take out in India, only less than 15% of the cancer patients present in early stage. 80 to 85% they present with the advanced stage or very advanced stage also. So when we are dealing with this, we should prepare the patient thoroughly when we are taking for any cancer treatment, especially if the patient is low nutrition, we have to correct the nutrition. If the patient is having any anemia, we have to correct the anemia. If you go in detail about, for example, lung cancer patients, usually 50 to 60% of the lung cancer patient have a bad fluid in their lung. We should remove it. Before removing, we cannot give any chemotherapy or surgery or radiation. That is a very important. Two things in this, especially in cancer patient, it improves the lung reserve, and second thing, it prevents the repeated lung fluid accumulation. That is the reason before going for any treatment, we should prepare the patient well. And in India, working up of the cancer patient is very slow, and also it is inadequate also. That is very important. You are going for the examination without much preparation. In fact, you are taking perhaps you are doing a gamble with the treatment also and for the exam also. So that is the reason thorough preparation is very much required when you are going and stamping it as a cancer, or staging or risk stratification is very much important in cancer treatment. Order of the day is day-care chemotherapy. Due to the corona and repeated infection within the hospitals, we should always do the treatment in daycare. Most 80 to 85% apart from surgery, radiation and chemotherapy, they can do with a daycare treatment only. So 80 to 85%, remember. So when you do daycare chemotherapy, infections are less and they stay in the hospital are less, and then psychological trauma will be less to the patient as to the attender. They can come go in the daytime only, and then they can take nutrition at the home, and hygiene at the home will be better, and more importantly cost effective, very much cost effective. 40 to 45% will come down if you have a daycare treatment. This is about the holistic approach in the cancer care. Myths in oncology or cancer care. We all know surgery and biopsy, many people says it increases, in fact it aggravates the cancer. It increases the stage, it helps in spreading the cancer to the other parts of the body. That is a 100% myth. Unless we do biopsy, we may not come to know what it is. It definitely does not improve the staging, does not upstage the staging. We need a biopsy to diagnose the disease and surgery to clear the disease. Everybody think that surgery and biopsy will increase the chances of spread. That is a 100% myth. Take it from me. And second thing is chemotherapy. Everybody think that chemotherapy is devastating and it will make you fatigue, it make you vomiting, it makes you hair loss. These things are there, but it is very negligible. Nowadays we have a high drugs to prevent the vomiting, high drugs to take care of the fatigue, and we have a lot more specialized persons to administer the chemotherapy, especially in medical profession as well as in nursing. We are improving day by day, and 2 decades back we don't had a medical oncology proper. Nowadays we are trained in that to chemotherapy to take care of the adverse events, Previously you have a lot of infection. To prevent infection, we have injections. To all these things will decrease the burden of chemotherapy, the chemotherapy side effects. And before that we had a very painful days following chemotherapy. Nowadays it's not like, we have a nanoparticles, we have a target therapy, we have a immunotherapy. The side effects are coming very minimal and very manageable and very transient. For a few days it will reverse it back everything. And second thing is radiotherapy. Everybody think that if you do radiotherapy we will get a burns. No, it is not like that. Before 2 decades back we had a very rough machines. Nowadays fine tuning is happened, and technology is improved, and precise radiation is also improving day by day. And most important things, people go for the alternative therapy thinking that this chemotherapy radiation may not work. That is the very drawback in our, when we see it is a very sad news, because people are coming with upstage and spreading the disease everywhere and missing that golden days and golden hours. We should look into it. And then diet as a minimal, unless we have a high protein diet, we cannot treat you with high dose chemotherapy or a surgery or a radiation. Diet is very much important. We cannot make you fast. We should always have a good high protein diet, balanced diet. In fact, we need a more energy during chemotherapy, during surgery or during radiotherapy. This you should deliver to everybody, and we should take out about all the myths what I told. If we diagnose any cancer early stage, our treatment cost will be reduced, duration will be reduced, psychological burden will be reduced. For example, if you take a CI breast, if you diagnose it in early stage, it will take 3 to 4 months of treatment, everything. If you diagnose in a late stage, we have to give lot more chemotherapy, cycles will be more, radiation will be more, surgery will be long. This is how, if you everything, if you come early stage, yes, we have a good outcome in all the ways. Thank you.